So dental cleanings and exams are the foundation for everything that we do here. We can't start halfway through and focus on one tooth when we ignore the rest of the mouth. What we want to do is we want to go in just like any other plan, building a house, coming up with a financial plan, planning for retirement, things like that. You go into it understanding everything, and then you can focus on specific areas. And that's what happens with our dental cleanings and exams, which are extremely thorough. Patients, I think, are sometimes a little overwhelmed with how much information we're gathering with scans, x-rays, photography, probings. All these things give us the important information on what your current state is and what we can do with that to improve it. So we don't want to focus on one area and neglect the rest of the mouth, or do a procedure on a tooth that isn't worth holding on to or needs other treatment to make it healthy before we do that. An example would be if you needed a root canal, we wouldn't want to crown the tooth first and then have to drill through the crown and ruin what you just worked on. We want to sequence it. And so we work with all of our specialists. We have an oral surgeon, we have a root canal specialist, an endodontist, we have periodontists work on gums. All these people are who we consult with in some of these more complex treatment plans so that we can start fresh and at a good solid foundation before we move on to the next step. And it makes it the most efficient way possible of doing things and the most cost effective, because we get the best result at the end and we're not redoing work, which is something I want to avoid.